Have you heard the term harm reduction and not really understand what it means for you or for your child or how that helps in recovery? I felt the same way too, and this is a term that I've recently learned more about, in the past few years, but definitely want to learn more and how it really can work with kids who are struggling with substance use. So, hi, my name is Kathy Tombaugh. I'm a parent coach. I work with parents who are concerned about their teens or young adults' alcohol or drug use. And I have a YouTube channel here with some videos that you can check out. Also, I have a website, kathytombaugh.com, a Facebook group that's continuing to grow, parents of children struggling with drugs or alcohol, and also a new training that you might want to check out and download. And you can just go to my website, and it's just on the right side. You'll see it up there to download the free training. So today, as I said, we're going to talk about harm reduction, and we're going to have a guest speaker, Dee-Dee Stout, who I'm so excited to have because she's an expert in this topic. So let me tell you a little bit more about Dee-Dee. Dee-Dee Stout has worked in behavioral health for more than 30 years, and she relates with her own personal story of addiction, other psychiatric diagnoses, and chronic pain to all conversations. Dee-Dee has been interviewed on television, radio, film, and print, discussing treatment issues, policies, and more. She has a private practice for individuals and family, is an adjunct professor for the Graduate Department of Forensic and Counseling Psychology for Holy Names University in Oakland, California, and is a frequent trainer across the country in evidence-based practices. Her book, Coming to Harm Reduction, Kicking and Screaming, Looking for Harm Reduction in a 12-Step World, is the basis for today's conversation. So let's get on with our interview with Dee-Dee. Welcome, Dee-Dee. I'm so excited to have you here. And yeah, so if you could just introduce yourself for people that don't know you and maybe just a little bit about what some of the work that you're doing.
Yeah, thanks, Kathy. I really appreciate being here. So I'm Dee-Dee Stout, and my master's is in health counseling. I have been a substance use counselor for nearly 35 years now. Hard to believe. And in that, I work with individuals and families, and was just part of our training and what we did. I was hospital trained originally, but I've worked in a bunch of different programs and a bunch of different modalities, as we call them. I'm also a professor currently at Holy Names University here in Oakland, but I've also been in many different universities and colleges around the Bay Area. What else do I do? I'm a coach. I call myself, in fact, a family coach when I'm working with families, because it's really about communication more than anything. There's some other things in there as well, but it's changing the language and changing our way of communicating with each other. That can be so powerful, both in a not so good way and also in a really good way to help people to make changes. And I'm a writer and an author. So I think I covered it all. I may have missed something in there.
Oh, yeah, wonderful, wonderful, great work that you're doing. So yeah, so our topic today is harm reduction. And so can you define harm reduction and what the term means for people who aren't familiar with it? And again, a lot of the people that listen to these are parents who are trying to help their kids, figure out how to change their lives and to live a healthier lifestyle.
So harm reduction it's a simple term and it's a difficult term in both ways here. So the simple way of looking at it is anything that reduces or minimizes the harm, the negative consequences of someone's, in this case, substance use. We use harm reduction strategies in all the other areas of our life as well. So the one that I usually talk about to help people to kind of conceptualize this is to think about cars. More people die in car accidents than just about anything. Not right now because of COVID, but traditionally that's been an area where particularly a lot of young people, get injured or die, unfortunately, right? And yet we don't outlaw cars. That would be insane. Right? We wouldn't, certainly not in California, right? We would never do such a thing. Right. So what we do is we work to make cars safer while we appreciate that they are killing machines in a way. I mean, you can go that far and say these are very heavily armored kind of tanks that we're driving around, although more of them are full of plastic these days, but they're still kind of these deadly weapons, if you will. And so we train people, we give them education around it. We do things like have seat belts and shoulder restraints. We have airbags. Sometimes our cars will have reinforced doors, and the manufacturers work consistently to make them safer. At the same time, we have things like speed laws. Right? So we do things societally that help to support this minimization of harm. You have to be 16 at least to have a driver's license, a training, and 18 to get a license. You know, those kinds of things are in place. So all of these ways that we look at reducing the harm, minimizing harms, rather than just strictly outlawing it. Mm-hmm. So that's what harm reduction is. Mm-hmm. Okay. And those strategies were then expanded into looking at other behaviors, mostly due to the HIV and AIDS crisis in the 80s and 90s.
Thank you. That really helps.
Yeah.
That helps you understand what, you know, we think of it like there's just one funnel through, and this way there's different ways to look at it. So, okay.
And a lot of people do just look at it with substances. And,
right.
And we like to say, yes, we do want you to look at it with substance use. Absolutely. Mm-hmm. And let's also look at how we're already using harm reduction in our lives, because so many people don't think of it in that way.
Right.
Yeah. So when it comes to substances, let me go to that for a second. So with substance use, everything fits under the umbrella of harm reduction. And that's another thing that's a big myth in harm reduction or in substance use treatment, is that somehow abstinence isn't in there. And we always want to say, well, how did that happen? Who said that? Because obviously abstinence can be, not for everyone, but for many people, that is the ultimate harm reduction. Mm-hmm. So of course it fits in there. It's just that we are not saying, you, Kathy, need to be abstinent. You know, that's not our job. It's certainly my job as a harm reduction counselor to bring that option up. This is one way that you might go about changing your relationship to substances and perhaps improving your life in some ways. And we can talk about steps you might use to get there. But I don't know. This is your life. You tell me what you'd really be interested in. So a lot of people that come to me, and I think this is true for many of us in private practice that are harm reduction counselors or therapists, people will say, well, I don't know that I'm ready to give it all up. Yeah, is there a way I can use safely? And I always say, I don't know. I don't have some magic ball here that I can look at and prognosticate what's going to happen down the future. But what I can say is that many people do. However, it's going to be up to you. So how are you going to know that it's working? How are you going to know it's not working? That's what's really important to me. Mm-hmm. What are your goalposts that are going to tell you? And if you are married or you have a partner or you have other family members, perhaps their opinions will also be included in that as goalposts. And so we want to have everybody in the room, if you will.
That makes so much sense too. And I think that's such a different approach than I think a lot of people get or families get. You know, they just sort of sit down and say, you know, this is the direction you need to go. So I really like the idea of, you know, what do you, you know, how do you want to handle this? You know, giving people options and giving them their responsibility for their change. So
yeah.
And I think it's a good point too, that a lot of people are not ready to just especially these young people who are like, you know, in their teens or early 20s.
Absolutely.
Sober for the next, you know, the rest of my life. That just seems, you know, not doable. So anyway,
they can't look at anything for the rest of their lives, and they shouldn't. Right?
No.
We don't want them to get married probably at 16. So, you know, why and how am I supposed to make this decision to be abstinent for the rest of my life?
Right.
When we live in a world that uses drugs every day.
Right. Yeah. Good. Okay. So again, parents are told that sobriety is often the only way to change. I mean, that's a lot of times the message if they're putting their child into a treatment program, you know, this is what we're doing. So, and then the other thing that I think comes up for me too is if a parent does like have a child home, how does that work if you're trying to figure out, okay, you know, is what he's doing safe? How do I know what, you know, what are the boundaries around this? What's good? You know, there's all these things I think that come up that make it a little bit, and I think that is probably the draw of sobriety. Part of it is because it's so black and white. I mean, either you're sober
Right.
or you're not. Whereas harm
Right.
reduction is a little bit more gray, you know. So maybe
Yeah.
if you speak to a little bit of that idea.
Yeah. So I think, and I appreciate that a lot of people, parents, partners, you know, want that. We could also throw the police in there because that's a lot of the route that unfortunately people will take. You know, they'll wind up involved in the criminal justice system, and the criminal justice system will only take abstinence as well. And something we're working on, but you know, that's where they are right now too. And again, you know, you pee in a cup and that tells you either it's positive or it's negative, right? So that's pretty straightforward. It actually isn't, because a lot of things can cause you to test positive that are not necessarily illicit drugs, but that's a whole nother conversation. So when it comes to people having boundaries around it, we like to say, well, how would you handle your child doing anything else that you're not comfortable with? And this is just another one of those risky behaviors in a grand scheme of risky behaviors, because that's the definition of being a teenager, right? That you are going to need to confront and you're going to need to have conversation. So for us, it's all about, again, the relationship that the person has to the substance, if I'm working with the individual, and for the rest of the family, it's about how are you communicating with that person to start with, you know. And oftentimes what I observe is that they're not. You know, that the rest of the family is sort of behind closed doors trying to figure out what to do, with the person who's using the substances is kind of off here on the side. In fact, we talk about the individual using substances and the family as two separate entities. I realized I was doing that up until recently and thought, my gosh, how did we get there? Isn't this still a family? Right? But our language is separating people out. So I'm trying to learn to say the individual using substances and the rest of the family so that I'm not doing that. I mean, these are the kinds of things that we think about, and particularly harm reduction folks, because language is important. So that's part of it. And with families, and saying, in the same way that too many professionals sit behind closed doors and make treatment plans for people that aren't in the room, that's not appropriate. You cannot make decisions for people without their input. And you can try, but it's probably not going to work very well, right? So the other thing that I realized, and being a former substance user and a chaotic substance user for a couple of decades, I started very young, so I had a lot of years of teenage years there. The one thing that no one asked me, not my parents, not counselors, not therapists, not psychiatrists, you name it, was, how come you're doing this? And not in a judgmental, finger pointing kind of way. That I got a lot of, the shaming. I didn't get, talk to me. What's going on? You know, it looks like you're in a lot of pain. It looks like you're not very happy with your life. And I'd like to help you somehow. Yeah, and maybe that's not possible. You know, that's another thing that we hear sometimes, that if I'm actively and chaotically using a substance, I may not have the wherewithal to be able to say to you, Mom, I'm in a lot of pain right now, or Dad, you know, I was sexually assaulted recently, and that's what's happening. So unfortunately, I think where parents tend to go when we have those kinds of conversations is, it must be our fault. We've done something to cause this. I mean, frankly, maybe you have. I don't know. I mean, none of us know. But I do know that that child lives in a world that's beyond just the family. So the idea that it could only happen within the family structure is pretty limited, right? It's probably something that's happened in their world that you are not aware of. And I hear a lot of parents talk about that 10 years later. They find out that these incidents happened. There was bullying, or there was a sexual assault, or, you know, there were other things that occurred that they had no idea about. That concerns me as a parent, and You know, my son didn't tell me everything either. That's part of it. But it's also about how do we keep those lines of communication open? So even if you feel like you can't be around that person that you love so much anymore because you can't watch this, I'm still going to advocate for how do you keep those lines of communication open? And at pretty much any cost, you want to keep that line open. Because if you are not doing that, if that person feels that's using the substances, your loved one feels alone and ashamed, I can guarantee they're not going to stop. In fact, I can almost guarantee they're going to use more, because that's part of the reason we're using in the first place. Yeah, I think too many people think, oh, people use substances for the euphoria. They just want to get high. They're irresponsible. You know, and maybe at first, sure, but not if they're really stuck into that lifestyle. And if this is a behavior that has now become entrenched, it has nothing to do with that anymore. I can guarantee that.
Yeah, good point. I know it is. I think you start out thinking I've heard some people say, you know, it solved the problem for me for, you know, a while, and it was fun or whatever. And then it doesn't. And then you're just struggling to, you know, maintain and try to function, and you know you need your substances to do that. So yeah.
And the emotions are overwhelming,
right.
that, that are coming up. So the substances work to kind of put a container on a lot of those emotions that we frankly aren't taught how to deal with.
Right. Yeah. And I love the communication part you said too. I think that's so, you know, I guess parents come up with that too. You know, they're getting messages. I just talked to mom the other day. Somebody's telling me to kick my kid out. You know, do I do that? Why? You know, try not to. You know, I mean, you know, sometimes with that, you know, everyone's different. Sometimes that has to happen. But there, you know, if you cannot do that, and because you're right. I mean, they're just, if they're isolated and feel awful about themselves, I think the chances are less that they're gonna want to get help. So good point. Okay, so
and can I say something to that about the kicking out?
Sure.
Just real quickly. Thanks, Kathy.
Yeah.
So I like to tell folks that is absolutely an option, right? You know, and you can only do it once. Right? So two things. First of all, if you say that, you need to follow through. Because if you tell me you're going to throw me out and then you backtrack every time you say it, I'm not going to believe it anymore. That's not helpful. Right? And second of all, that you can only do that one time, right? That is, it's like, you know, in the old card games, that's my trump card, right? I can only play that once. So save that for the last thing you do. Don't let that be the first thing you do. There are lots of other options before you get to that point. And so a lot of times that's all I'm really doing is working with folks to scope out and to strategize those other options, while saying, you know, keep that one back here. Absolutely, that's in your bag of tricks. But let's see if we can try some other things first. And most people that I've worked with, and I'm sure you've seen this too, are more than happy not to do that. They really don't want to do that. They just don't know any other strategies, right? Yeah.
No, good point. Yeah, no, that's great. And I like the idea of just doing it one time and keeping it, you know, the last thing you're thinking about. So yeah. Good points. So, all right. So Dee-Dee, do you have a case study of someone who's using harm reduction and how it's affected the family or what boundaries they set up? So, and, you know, just an example of how this would work really in a family situation.
Yeah. And, you know, the way that it works in a family, obviously is going to be different with every family. That's one of the things I love about harm reduction, that it's not a one size fits all. So it's not, here's the step-by-step process that we use. You know, if you look at harm reduction therapy, which many of us have been trained in, there's an actual book sitting behind me here. Pat Denning, Jeannie Little wrote it, who are here in the Bay Area. And you look at the different strategies or the different aspects underneath this umbrella called harm reduction therapy. There are some 13 different items. You know, everything from family work to a mental health assessment, to nutrition, to social skills, relapse prevention, medication assisted therapies, you know, on and on and on. So it's quite complicated to do harm reduction work. Abstinence work is simpler, as you described, that sort of black and white, you either are or you aren't, that kind of thing. So I appreciate that in a lot of ways, that simpler, right? And by the way, most of us in doing harm reduction therapy or counseling will ask people to be abstinent for a period of time. We call it sobriety sampling. And I will invite every single one of my clients to do that. Now, sometimes they're not capable of doing it for the 30 days, which is generally our benchmark. If they can't, that's fine. And I try to encourage people not to use judgment, but to look at this like a budget, a financial budget. So if you're going to look at a financial budget, if you don't know what you're spending, how do you know how to budget, right? So I want you to write everything down, but I want you to do that without judgment, just so we can get a baseline of where you are. And I do the same thing around alcohol or other drugs. So think of, start writing down all the times that you're using, or use an app for that, however you want to do it. And let's see when you are drinking or using other drugs and how come. What are the effects? Simply doing that, believe it or not, can cut back people's drug use. And by drugs, I mean everything. And it's quite amazing. It's like with food, if you start paying attention and being mindful about what you're eating, you tend to eat less. So it's the same kind of idea, all right? So that's kind of a starter. And again, the conversation is always about the relationship, which confuses people a lot. I'll tell you, when I tell them we're going to look at your relationship to drugs, and they'll always say, I don't have a relationship with drugs. What are you talking about? I go, yeah, you do. I'm not suggesting that's a bad thing or a good thing. It just is. That's part of what we want to look at and see, what is it costing you? What are those negative consequences? But also, what are the positives? Because you must be getting something positive from that behavior, particularly if you've been engaged in it for a long time. We humans don't tend to do things over and over and over and over again if we're not getting something from it. And that can be difficult for people to admit, that there's a positive side to drug use. The American culture doesn't really allow for that space to have that discussion, and that's a problem.
No, I like the idea of writing down. Yeah, and that works with so many things too. Finances, food, anything. You start
exactly.
Yeah, so that's a good
So
one.
that's kind of part of working with an individual. If I'm working with the rest of the family, so part of what we're going to do, again, is looking at changing the communication style. So looking at, how are you when you have challenges with someone? And I'm thinking of a family that I worked with for a long time. And one of the challenges that we had, so I would meet with their child, their young adult, beforehand, and then I'd meet with all of them together afterwards. And the parents would ask me, well, how did it go today? And I'd say, your child is sitting right next to you. Why don't you ask them? I mean, that simple act of just shifting, looking at me, the professional, as having this answer. I'm happy to tell you what my feelings about it are, but I think it's more important to find out, how did they find it, right? And whether or not they feel comfortable sharing that, right? So that's another part of this. So with families, I like to give them some homework if they're willing to do that. Because again, it's about changing how we communicate. And this through craft and through other things that you've been trained in, that we really want to look at a different way of communicating. So one that keeps the lines of communication open, that has some real teeth behind it. So I want to catch people doing things right, more often than pointing out what they're not doing or how I don't like what they are doing. So instead of saying, Kathy, I really hate it when you yell at me because I didn't wash the car right. That's less helpful than saying, Kathy, you know what? When you talk to me in a way that shows me how much you care about me and tells me that I'm doing something really well, that means a lot. So we want to teach parents to say things like, I really love it when you're not under the influence, using meth, let's say, and we're able to go out and have dinner together. Those are really special times that we all look forward to. Yeah, and just let it lay there. Yeah, if you want to say something, if you've made plans, let's say, and that person shows up and they are under the influence and it's obvious, and that's your agreement that they're not going to be under the influence when you get together, that's a pretty typical one, then you can say to them, gosh, it's really too bad. We can tell you must have had a rough day today. Yeah, and you know, our agreement is that we only get together and go out when you're not under the influence. So, you know, it's okay. You know, let's give you a ride back, or, you know, do you want to stay here and have something to drink, you know, have a Coke, have some coffee before you leave, and let's plan to get together in a couple days. Rather than the, oh my God, you've done it again. Every time you show up, you're under the influence and I can't take it anymore. And here I go. Right. And I've done it. You can tell. It's not effective. Not effective at all.
Yeah.
Yeah. So it's working in those kinds of parameters of how to shift both the conversation, but also bringing a lot of love in there. Yeah, a lot more positivity. And there's a research concept called contingency management that you may have heard of. And essentially what it means is rewarding positive behavior. In this country, we don't use it in treatment, even though it's extremely effective. Lots of other countries use it. Tons of research done on it over many, many decades. And I did a study one time and said, so why are treatment facilities not using this? And without exception, all of them said, why should we be rewarding people for behavior they should be doing in the first place? So, well, I guess that's one way to look at it. However, this is really effective. So, do we want effective treatment, or do we want to be right and feel righteous? And I'll leave that to other people to answer. So, if I could, kind of in that ballpark here, there's a piece from the quote of a story by Gabor Mate, who many people know from his writings and other work. And I think it sums this up really nicely of how we can change how we talk to people that we love that are using substances problematically. And this is the quote. We weren't quite finished yet. I wanted to know about family members who are dealing with addiction. What can they do for a loved one who's caught in the grips of active addiction? Because when people are that deep in addiction, they've lost themselves. They're gone in a way. I know I was, and this is the author speaking, not Gabor Mate. I know there was nothing my family could have done, no matter how much they wanted to. Gabor didn't agree with me. He said, you don't know that. What you do know is what they tried didn't work. But you don't know that there's nothing they could have done. In one sense, you're 100% right. There's nothing they can do directly to change your mind. There's nothing they can do directly to change your mental status. There's no way they can talk to you, advise you, control you, beg you, accuse you. That does not mean there's nothing they could have done. Imagine if your family had come and said, Chris, here's how it is. We recognize your addiction is not your primary problem. Your primary problem is that you're in a lot of pain. And that pain is not yours alone. That pain has been carried in our family for generations. And we're as much a part of that pain as you are. You're just the one who's soothing it with that behavior. In fact, you're the one whose behavior shows us how much pain there is in our family. Thank you for showing that to us. So we're going to start working with you because we realize that we're as much a part of this as you are. We're going to take on the task of healing ourselves. We invite you to be there if you feel like it. And if you're not ready, sweetheart, then just do what you need to do right now. Is that not amazing?
That's beautiful. I mean, I was just like,
I know. I have a hard time getting through it.
I know.
That by the way, that is from a book called Dead Set on Living.
Okay.
Got a little cover here, Chris Grasso.
Okay. Okay, I'll have to check that out. No, that's, and you just, yeah, I know. I mean, a couple things you brought up. I think that, and if parents can just sit down and sort of take a breath
Oh,
and step back and say, you know, what is really going on here? You know, let's look at the
yeah.
whole picture and how can we help, and how can we help ourselves first? You know, how can we
Yes.
start with us, you know,
Put on your own oxygen mask.
yeah.
And that's so important to take that breath or several breaths, right?
Mhm.
Nothing needs to happen right this moment.
Right.
And you just have to believe that no matter what the crisis is,
Mhm.
that you can take that time, at least a few minutes. Um, I call the bathroom an underutilized place to go hide for a few minutes that most people won't follow you into unless you have really little kids or pets, right? But,
Dog.
most people, exactly. I had a golden that always did that, but most of the time we can go in there. I teach people some breathing, very quick breathing skills and techniques to get that breath in the moment, just because we cannot have these conversations when we're all activated. It's not going to be good.
Mhm.
And we're all going to screw up, and we're going to do that from time to time because we're human.
Oh, absolutely. Yeah. You just have
It's
to try.
okay.
You know, you just have to try. Yeah. No,
Yeah.
that's beautiful. Wow, what a gift. I'm gonna
Yeah.
definitely, yeah. Oh, keep that one. That's
Yeah.
really amazing. Um, okay, thank you so much. So Dee, how can people find out more about you and your book, Coming to Harm Reduction, Kicking and Screaming, which was a lovely book, by the way. And again,
Thanks.
I think I mentioned this to you earlier, is I really like how there's different authors of each, you know, each different
Hmm.
people put
Hmm.
a piece of it. And I think it really explains harm reduction for a lot of us who just really weren't clear about what it is. What does it really mean? So,
Yeah. And frankly, I wasn't taught what it is correctly.
mhm,
When I got my drug and alcohol certification, I was certified in the state of California for 20 years, and then I taught in programs for a long time, many decades. And it wasn't until 20 odd years ago that I came to harm reduction, which I know now because my story is in the book. So, I come out of a 12-step tradition, and these things can work together. There is no need for them to separate. But a lot of people do separate them, unfortunately. So to find out more about me, obviously my website would be the place to go, and I am in the process as we speak of updating it. It's going to be on a brand new platform, all new stuff up there, but it's DeeDeeStoutConsulting.com. So Dee is DeeDee Stout, like the beer, ironically, STOUT consulting.com. And the book is available everywhere, and of course on Amazon, like the whole world is. That I'd be delighted to speak to anyone as well. I always offer, 30-minute free consultations to individuals, to other family members. If you just want to chat, if you need some help, or clinicians, if they're looking for some assistance, I do that as well.
wonderful. That's great. You're a great resource. So nice to have.
Thanks.
And yeah, it's really, I just think it's, I think for a lot of parents, and I know you've talked to moms too, and I think there's just this frustration of not having these approaches like harm reduction or even
Mhm.
a MAT or some of the other ones who just, they're not as mainstream. They're getting there. We're getting there, but they're
Yep.
just not as mainstream as we would like
Yeah.
to see. And I know it causes, frustration for parents.
Yeah, I am very grateful. I get more and more calls and emails from parents who are saying to me, "We're not willing to throw our kids out.
Mhm.
There's no place for them to go in the middle of a pandemic, and with the economic crisis the way it is, they can't afford to be out there on their own. So we're not going to, and with fentanyl in everything, we're not willing to take the risk. Now that could mean death, and no, that's not worth it. And yet we can't have them here engaging in all of these behaviors either. I don't care if they're smoking cannabis, but I do care if they're using X, Y, and Z, right? Those kinds of things. Can you help? And I always say, I don't know, right? But we can have the conversation, and there are lots of options beyond just throwing them out, just asking them to be abstinent. Yes. So I'm delighted to get those kinds of calls, even though it's always painful to hear that as well, because unfortunately it's usually pretty bad by the time folks get to me.
No, I know. It's tough.
Yep.
It's a hard topic, but you know, there's people like you out here doing this great work. So I appreciate it. Thank you so much for taking time to come
Thank
talk
you,
to
Kathy.
us and share with parents. And oh, they're gonna love some of the information
Yeah.
you shared. It's wonderful. Oh, it's really great.
Yep.
So yeah,
People do not have to hit bottom, and you don't have to throw them out. There are options.
right. Yeah, good to know.
Yeah.
Okay, DeeDee, thank you again for stopping by. And
Absolutely.
okay, take care.
Thank you, Kathy.
Uh-huh.